Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the recent measles outbreak in the U.S. What is measles?
Measles is actually a disease that is caused by a virus that spreads from one human being to another. And the issue with measles is it's a very contagious virus, as in it can spread very easily amongst human beings.
So we've been hearing that we're on track to have the most measles outbreaks since the last 6 years. Why is that?
So one of the reasons is we're traveling a lot more. So the number of cases of measles are going up all around the world. So that's one aspect. But the issue in the United States, one of the reasons why we're seeing a rise in the number of measles cases is because of the number of people who are vaccinated or can be vaccinated against measles. That number has been dropping. So we normally would like to have 95% of the population vaccinated against the virus, but that number has dramatically dropped in the last few years, and it continues to decline. And therefore, as a result, since fewer people are actually protected against the virus, we're seeing a rise in the number of infections right now.
So what are the symptoms?
So the symptoms, unfortunately, like a lot of viral diseases, the symptoms start off with a fever, a high fever, a cold, a runny nose, a cough, the same standard symptoms you might get with any viral illness, but then it could spread beyond that. So the next stage after those symptoms will be some white spots inside the patient's mouth. And after that, the next stage would be rashes or red rashes all over the patient's body. And so that becomes the spread of symptoms, and in some cases, if it goes beyond that, it becomes a complication, and complications can be quite dramatic and bad and include things like blindness, really bad ear infections, and sometimes death.
You mentioned vaccines. So what are the vaccinations that are available?
There is one vaccine that is available against the measles. It's part of a group of vaccines, and they're called the MMR vaccines. And there are 2 doses of that vaccine that people usually get. Most of us get them. The first dose is given when you're between 12 and 15 months of age, and then you get a second dose when you're around 4 to 6 years of age. And the great thing about that vaccine is if you get both doses, there is 97% protection against coming down with measles. And even if you don't have both, if you have at least one of those vaccines, the first dose, it's 93% protective. So this vaccine has been around since the 1960s. So it's a vaccine that's been around for a long time and is very, very efficacious.
Any last thoughts?
The same thing, as I just said, getting the vaccine really protects you against the virus, and that's the best way to ensure you don't come down with the disease. And even if you do get the virus, then your symptoms won't be as dramatic, and you would be able to fight off the virus. And given that, especially that in young children, this virus can really cause problems such as blindness or hearing problems. It's something we'd want to protect children at a young age from, and in that case, vaccines are the best way to go.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.